In a recent study, 19,000 people were observed for 17 years, and only 213 people developed an SA node dysfunction. That is 0.6 out of 1,000 people per year. It is important to know unusual conditions of the heart so that you or people around you will be able to be more aware of their own bodies and when to seek medical attention. As a former nursing major, I took many pre-nursing classes, and the importance to know dysfunctions of the heart is very important. Today I will be informing you on a clinical level what sinoatrial blocks are, what causes them, and how they are diagnosed. Also known as a sinus block or a sinus pause, it is a disorder initiated in a sinoatrial node when the action potential of the SA node is delayed or blocked on the way to the atria, causing failure of depolarization to the atria, resulting in a missed atrial beat, known as a P wave on an ECG. This can also be known as failure to conduct cardiac cycle. It is progressive, incurable, but a manageable disease. Now that you know a little bit more about a sinoatrial block, now it is time to get into what causes them. One of the first causes include excessive vagal tone, which causes an increased heart rate when inhaling or decreased heart rate when exhaling. The vagus nerve allows the heart to pump blood to the brain, so when there is an excess of vagal activity, it can prevent the heart from pumping blood to the brain, which can lead to many disturbances of the heart's function. P cells, also known as pacemaker cells, may develop a dysfunction. They are in the high right atrium of the superior vena cavae. They are responsible for conducting the heart rate and are the natural pacemakers of the heart. When there is a dysfunction of the P cells, they are unable to work properly. It can lead to a SA block. SA dysfunction can result from ischemia or necrosis of the P cells, from a decrease of arterial blood, and worsening coronary artery disease, or myocardial infarction. When the occurrences of the SA node will not be able to function properly, resulting in sick sinus syndrome. Without proper function of the SA node, the P cells will not be able to function properly, resulting in other myocytes automatically take over and become the new pacemakers for the heart. SA blocks can also naturally be caused by aging along with other heart problems. Sinus pause occurs when there is a problem initiating electrical charges from the SA node. Most common symptoms include altered mental status, dizziness, shortness of breath, chest pain, and irregular blood pressure. If symptoms are not present, it is almost unlikely that it will be diagnosed. Most times, symptoms will not appear to allow diagnosis until 24 to 48 hours before cardiac arrest. This is why it is so important when experiencing these symptoms that you seek medical attention immediately. When reading the ECG, it is important to pay attention to the P waves when detecting SA blocks. Because there is a lack of electrical charges coming from the SA node, there will be a loss of P waves, or atrial activation, which will indicate no atrial depolarization. In first-degree and third-degree blocks, they cannot be detected with a 12-lead ECG but can be diagnosed with an electrophysiology study, which is a small wire placed against the SA node in the heart and can detect the electrical impulses. First-degree SA block is diagnosed by a lag between the SA node firing and depolarization occurs of the atria. Although there is a short pause, there will eventually be depolarization of the atria. There are two types of second-degree SA block, type 1 and type 2. Type 1 has an irregular rhythm with RR intervals, progressively getting smaller and PR interval remaining constant. The PP intervals progressively shorten until the P wave is dropped altogether. Second-degree type 2 involves a regular rhythm that is often normal to slow that is followed with a pause. While type 1 progressively shortens, type 2 remains constant until a P wave is dropped altogether. Third-degree blocks have no P waves, in most cases cannot be indistinguishable with sinus arrest, meaning when there is a third-degree block, the heart altogether stops making any type of cardiac cycle. You are now informed of sinoatrial blocks, how they are caused, and diagnosed. Sinoatrial blocks can be a very serious condition regardless how rare they are. They are still important to look for along with other heart conditions. I hope this presentation helps you to watch your personal health and others around you. Heart dysfunctions are a serious matter, so it is important to strive for a healthy and happy heart.